Hi folks, it's John Adamson, the Rehab and Documentation Guru, bringing you a video on a rainy day. And I wanted to do another reading from the RAI manual for those of you that work in the SNF setting. And this time I'm going to be reading about co-treatment. And for guidance on co-treatment, all you have to do is go to page 510 out of 1,309 pages of the RAI manual. So there's a lot of them. And you'll find this paragraph. And so I'm going to read from it and then give you a basic interpretation related to some concerns I've seen about people billing for group concurrent at the same time or co-treat at the same time. Anyway, let's read this. Co-treatment for Part A. When two clinicians, therapists or therapist assistants, each from a different discipline, treat one resident at the same time with different treatments, both disciplines may code the treatment session in full. All policies regarding mode, modalities, and student supervision must be followed as well as all other federal, state, practice, and facility policies. For example, if two therapists from different disciplines were conducting a group treatment session, the group must be comprised of 2 to 6 participants who are doing the same or similar activities in each discipline. The decision to co-treat should be made on a case-by-case basis, and the need for co-treatment should be well documented for each patient. Because co-treatment is appropriate for specific clinical circumstances and would not be suitable for all patients, its use should be limited. Now, some people have been told that they can group and co-treat at the same time, and this language here makes it a little bit difficult on the part of the therapist. But here's my interpretation, and my interpretation is that co-treatment should happen irrespective of group. You should not be doing group and co-treatment at the same time. Co-treatment, you're basically saying that you need to work together because of some combined issue going on with the patient. Patient's very medically complex, for instance, and can't tolerate two separate and distinct therapy services working with the patient at different times. So you combine your session, and PT maybe works on gait dynamics while OT works on the patient doing an ADL at the same time, because that patient's so complex that you have to do a co-treatment. And notice it says that you are treating one resident at the same time. I take that language to be very restrictive, meaning that you can't co-treat at the same time as group. One resident at the same time with different treatments. Now, some have gone on to interpret that it talks about different modes and group. Why is that mixed in there? I don't know. I think it's confusing, and I think it sets you up for some really bad practice. Also, because this clearly states that co-treatment involves one resident being treated by two disciplines at the same time, I would stick with that as being your guide and not go beyond that and try to group and co-treat at the same time. I think it's a bad practice. I don't think you're going to achieve good therapeutic outcomes anyway. There's a reason we do co-treatments. It should be well documented. It should be infrequent, because here's what it says at the very end of this. Because co-treatment is appropriate for specific clinical circumstances and would not be suitable for all residents, its use should be limited. So here's a scenario. A lot of you are being told you've got to group patients 25%, which is not accurate. But anyway, you're grouping your patients and you're doing co-treatment at the same time to try to fit your groups together. And it's a matter of convenience. But what Medicare is saying is co-treatment should be limited. And when they mean limited, they mean that they shouldn't be seeing it very often at all. And it should be infrequent. And you got to have really solid documentation to support why you needed to co-treat. Anyway, hope that clarifies. So don't group and co-treat. I hope I didn't mix the word concurrent in there. At the same time. Do not group and co-treat at the same time. because Medicare seems to stipulate that it should not be done. Hope you have a great day. Take care and God bless.